Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Diagnosis of the patient with hepatic adenoma. Right. Hepatic adenoma, how do you diagnose a patient? You will do an MRI. On MRI, you will see that there is well demarcated heterogeneous mass is present. So in the MRI, you will see that there is a mass which contains fat and hemorrhage is present. So in the mass, you will see presence of fat, and along with that, you will see presence of hemorrhage is seen on MRI. Okay. Next, CT findings in hepatic adenoma. So, in the CT findings of hepatic adenoma, what do we see? We see that hypervascular and heterogeneous. On CT scan, we see that there is hypervascular and heterogeneous mass is present on the arterial face, and this becomes isodense or hypodense in the portal face. Why? Because of it becomes isodense and hypodense in the portal phase due to arteriovenous shunting. Because of arteriovenous shunting, first normally it will be hypervascular and heterogeneous. Hypervascular because of hemorrhage and the fat, and there is heterogeneous. Actually, hypervascular because of increased blood supply, and heterogeneous because of the presence of hemorrhage and fat in the arterial phase. Whereas when the contrast comes into the portal phase, the same lesion is seen as isodense and hypodense. Okay, the main features, these are important for, yes, the other features which are seen in hepatic adenoma is, you will see that the hepatic adenoma has a smooth surface in almost 95% of cases. There is presence of necrosis and hemorrhage is seen in 25% of cases, and tumor capsule is also seen in 25% of cases. So these are the CT findings in hepatic adenoma. Then you do an angiography. If you do an angiography, okay, you do an angiography, okay, in the angiography you will find that there is hypervascular well circumscribed tumor is seen, and which is supplied by the peripheral arteries. Okay, a tumor is seen which is hypervascular tumor is seen which is supplied by peripheral arteries on angiography. In difficult cases, resection can be done for diagnosing. Resection for confirming a diagnosis can be done in difficult cases. In difficult cases, we can do resection for confirming the diagnosis. Okay. Then, treatment of hepatic adenoma. In the treatment of hepatic adenoma, first we will see acute hemorrhage. Hemorrhage is the main complication of the hepatic adenoma. In acute hemorrhage, you can do, first you will stabilize the patient. First and foremost, you will stabilize the patient, and followed by stabilization of the patient, we do a hepatic artery embolization is done in the patient, and following which we can do a resection of mass can be done in acute hemorrhage. And if there is symptomatic masses, if there are any symptomatic masses, we can resect those symptomatic masses, and we can also, if there is, if the patient is trying before planned pregnancy, we can also resect the hepatic adenoma.
thank you and thank you for watching.